Okay, hi everyone. Welcome to MHTC podcast, Health Beyond Borders. Okay, so it's presented by MHTC, iaitu Malaysia Healthcare Travel Council. I'm your host Afika Jalil. So today we are diving into something that spreads faster than the flu, which is doctor versus Google. Okay, health viral myth. Okay, so today from detox drink to cracking knuckles, TikTok and WhatsApps groups are full of health hacks. But how many of them are actually true? So today we're going to bust some of the biggest myths out there with the help of a real medical expert. And today we have our special guest. Welcome, Dr. Vickneswaran, consultant neurosurgeon. Hello, doctor. How are you?
Hello, hi Fika. Hi. Thanks for having me.
Okay. And also we have Encik Rizal Shaharudin, Manager International Marketing from Subang Jaya Medical Center. Welcome, Encik Rizal.
Okay, thank you. Morning.
Okay, we appreciate you taking the time to be with us today in the studio. So, if you have ever wondered whether you are being healthy or being full, this episode is for you. Okay, let's get into doctor versus Google. So, before we begin, I have a little confession, doctor. Okay, I'm actually one of the people who turns to Google or ChatGPT every time I feel like something feels off. Such as for example, if I have a headache at my right side, I would always go to the Google or ChatGPT. Why is that my brain?
Do I have a brain tumor?
Yeah.
So
that-
actually, that's quite common, quite normal. Even I Google an AI sometimes when I have a complaint because we cannot know everything.
Yep.
And ChatGPT and AI is so convenient, right? I got a phone, I can click, I can do. Now, the question is you need to know which information is real and which information is not. Okay. So I tell all my patients that, yeah, it's fine to Google, it's fine to use AI. It's fine to, yeah. But at the moment, start off by just looking the main highway, the main reference points. Don't go into all the small lanes, the ceruk. So don't go into all the small lanes because then you can get misled, right? And the good thing is always double check,
Yes.
cross reference, and then if you are in doubt or if you're not sure, always consult an expert, right? Always see a specialist, go to a proper hospital, because now there are lots of places that claim to be like clinics,
Yeah.
or who claim, there are some doctors even who may claim to be, who peddle certain treatments that may not be acceptable. So go to the main places, ask for proper opinion, right? And I would also tell you that you can compare the opinion that maybe I give you to what Google says. And then you can turn around and ask me again, so, but Google says this. As long as you ask politely, it's okay with me, right? So, and that's my job next to then answer to you and try and convince you why what I'm saying is correct.
Okay, and how often do you encounter patients who already diagnose themselves via Google or ChatGPT?
Well, I think that's getting more and more. And actually, that's not different. I mean, 25 years ago, we will ask the makcik next door or your cousin or whatever, and that's your information source, right? From one single point. Then we moved forward. Then we started to have Google. So Google gives you a list of things that can be wrong, right? And we checked with Google. And more people started to use Google because Google was easily available.
Yes.
Today, you have social media, and sometimes I think social media can be a little bit dangerous because people are claiming to be experts, right?
Yes.
But if you yourself search under AI, for example, it'll give you things, and it's more than just a list now. Now you can have a conversation with it. It can explain things to you, and then it can give you information, and then you can cross-refer, right? And so even more people are doing it. So amongst the younger generation today, I think the vast majority of my patients who come to me, because I'm a specialist, right? So the vast majority of my patients who have come to it have done some research work on it already. And so I must be prepared for that research work that they could have been done. So I have to be on top of my game as well. And so, how many percent? I would say that has increased. It has increased, and it's increased exponentially. Yeah.
And the rise of TikTok doctors, as you said earlier, especially TikTok. People nowadays use TikTok, okay? And health influencer, they claim as a health influencer. What do you think? Is it help or harm?
Some of it can be useful. Some of it can be downright dangerous. Okay. I will go to the dangerous first. So we have anti-vaxxers,
Yeah.
right? That's the biggest issue, right? Everybody's a clever anti-vaxxer. But hey, if you were in the hospital at the time COVID was maximal and you saw the number of patients dying, and until the vaccine came out, and then only the incidence starts to drop. Because at that time I was in PPUM, and you can see the hearses parked to take patients out who are dead, right? They had containers which to store frozen bodies, which means it was overwhelming the PPUM mortuary already, right? And then the moment the vaccine came out, and soon after that, the numbers dropped. But today, all these clever anti-vaxxers are pandai-pandai saying, oh, we did this, we did. Something is seriously wrong. And today, the number of, if you look at the recent reports, the number of people who are not taking vaccines is going up. And that is seriously dangerous. Yeah, that is seriously dangerous. And a lot of things they say is not based on science. We have to understand something about medicine, things like vaccines. Nothing is 100%. There's always a possibility that you may be the unfortunate person who will develop a reaction to this thing. But this is still useful for 99% of the people. But we cannot get the 99% to believe this 1%, right? Then it becomes exceedingly dangerous, right? So you cannot believe beyond what an influencer might say, and you should cross-reference what they say. If you listen to influencer, fine. Cross-reference that to using AI or even Google. Is this true?
Yeah.
Right? You can do that, or you can ask a proper expert.
Yeah, we can say it's a harm if we go to something, we read something. I'm the person who read about a negative effect of the vaccine and all, which might be, it's actually menakutkan. It's very frightening. So it's a harm if you go to the wrong platform.
It is.
It
It is. Because as human beings, we want to believe only the good things.
Yep.
So, because I do brain surgery, and brain surgery carries certain degrees of risks with it, right? So patients ask me, how dangerous is it? I said, you got into a car and you came to see me. You have a risk of an accident, right? But you still get into the car and you go everywhere, right? So how come that's different? So there are risks associated with everything that you do. But it's whether you are careful, whether the experts you are seeing are competent, whether the equipment the hospital has and is good, whether the experience of the people treating you is there. And if influencers say some negative things, maybe you should check it out and see whether betul is negative or it is just their perception.
Yeah, I always wanted to say that most people sometimes need to believe certain people punya kepakaran, such as doctors. You have experience and learning about the science and everything. So maybe people should open their mind to accept that, to learn that setiap orang ada kepakaran masing-masing. Okay, and yes, yeah. Okay, thank you for that. Thank you for that.
You're welcome.
Answer. I feel okay. Okay, let's proceed. Okay, kita proceed. Let's move forward to nowadays with apps like what kind of technology? I want to ask doctor again. Okay, what are kind of technologies do neurosurgeon use?
Oh, neurosurgery. Someone asked me once, why do you do neurosurgery? I said, because all the fun toys come to neurosurgery first. All the fun, shiny toys. So we have loads of things. So, for example, just like ways, we have navigation to find your way around the brain. We have got amazing imaging systems, for example, in Subang, that can tell us, is it a tumor, is it not a tumor, how to find our best way through, how to get out. We have methods in which to plan our surgery, how to get there with minimally damaging the brain. Technology has also come where some of these things can now be treated without surgery. It can be treated with radiation, focused to just treating that tumor and not harm the brain. We have got technology that can treat blood vessel problems without opening the head. So the technology is immense today, and major hospitals like Subang has got everything that you need. That's equivalent to any first world country, right? Yeah.
And nowadays with apps like Waze and GPS guiding us everywhere. As for me, I use Waze juga. Okay, and is it true that relying too much on them can reduce our brain activities or even have negative effect on our cognitive functions?
I don't think so. I mean, dulu we used to use maps, isn't it?
Yeah. Oh
We
yeah.
used to, yeah, you see, people have forgotten how to look at a map, right? So Waze is just a map, right?
Yeah.
But you still have to use your brain to understand whether Waze is
Yeah.
telling you is true or not. There's always this joke, right? Waze said turn right, and in the right of you there's a lake. Don't turn right, lah. Okay, so you have to use your brain. You still have to use your brain to decide whether the fastest route or the shortest route on Waze, and you still have to drive properly. But technology is forever going to evolve, right? I'm sure when they invented the first wheel, when ancient men invented the first wheel, someone must have said, oh, this is going to stop us from walking and exercising. Did it stop? No, it didn't. So technology is there, but we use it prudently. Yeah.
So for those who are afraid to use Waze or ChatGPT, don't worry, your brain's still functioning.
Yeah.
Your brain's gonna still
Yeah,
you're still gonna use your brain.
you're still
and
going
it's
to
not
have to
gonna,
use you're still going to have to use your intelligence to frame the question.
Yeah.
Jangan percaya mentah-mentah lah. Don't just believe the whole thing that ChatGPT gives out, because ChatGPT can hallucinate as well.
Yes.
Right? So everything you find, you check. Didn't your mother say to you, don't believe what everybody says to you, always check? Yeah. So it's the same thing. So when you give something to you, you take it, you should cross-reference it and check and see whether it is correct. The problem today is most people want real shortcut and they don't want to check, because human beings by nature are lazy. So we don't check. So it says something, yeah, we just believe her.
Yes,
Yeah.
true.
So you're not going to run away by not using ChatGPT, right? You're not.
Betul. True.
Yeah. You see, for example, some of the questions asked today probably got generated by ChatGPT as well.
Betul.
But the person who's framing the question and asking the question has to make sure they change it, contextualize it, and all that, right? Yeah. So I don't think our brain is going to become any weaker by using it.
Okay. And let's get back to our topic. Okay. And okay. Encik Shah, Encik Shah Rizal Shaharudin, I want to ask, what's the weirdest health myth you have ever heard? Mitos yang paling weird you have ever heard before?
Oh, okay. Thank you for the question. Talking about health myths, actually you can find a lot of health myths. I mean, by searching, googling. But I think the weirdest thing is there's a lot actually. Maybe something like even what to say that
Lemon could lemon could
make
kurangkan cholesterol or something.
we,
What do you think?
it does
Drinking
somehow.
lemon.
It does. Lemon
Okay,
lemon
it's not,
do
it's not
help.
myth. It's not
Yeah.
myth. So something
sir.
like
Yes, I believe all the
Okay.
people that would like to kind of like diet or lose weight, yeah, they took lemon.
Lemon,
I
yep.
think
detox drink. Detox drink
yeah,
could.
it's a detox drink. But if you're talking about health meat, is something like don't watch too near to the television.
Oh,
Will
yeah.
spoil your eyes.
Is it true?
Uh, I I used to work with eye hospital before.
Oh.
Okay. There is a very small. There's no like really evidence base that saying that watch near will spoil your eyes. But I think in long run, if you watch like for like 5 hours straight, definitely even you're not just going to have a bad eyes. You're going to have a bad even you say your spine because you're just sitting there. Even your brain, you just watch there for 5 hours, you're not moving at all.
Yeah,
It's
betul.
something like that.
Betul.
If you watch close to a television, but at a certain amount of time, that okay. For example, like just 10 minutes, I think it shouldn't be a problem. That kind of helped me that I got during my previous work in eye hospital.
Hospital. Thank you for that. And doctor, for you, the same question. What's the weirdest health myth you have ever heard?
That maybe eating too much of a certain thing causes you to have a brain tumor, for example.
Okay.
Okay, that's not really true. Another health myth is if you use your brain too much, it's going to become very weak, right? Or you shouldn't study too hard, right? So that's a myth. The more it's like I always say the brain is like a muscle. If you use it, it becomes stronger. If you don't use it, it goes to waste, right? But health myths, sometimes I'm not sure whether they are really myths or because there may be some little bit of usefulness in it. So if you drink a lot of water to detox, if you drink lemonade, lime with water, is it the water that's detoxing you or is it the lime in the water that detoxing you? Answer is I honestly don't know. Yeah.
And as a parent, I always say to my kids, don't watch too much, don't play too much games. Later your brain become slow or tak focus, something like that. What do you think? Should I change the sentence after this, or
I think
is that a health myth?
I don't know whether there's a health myth or not. I mean, when you play a lot of games, I don't think it affects your concentration. But what it does is it affects your ability to socialize.
Oh yeah.
Yeah,
Okay.
you become and you can become like you only want your company and the person. So I think that's the bigger problem than you gaming. Yeah. You gaming improves your health eye coordination. We say that those see today, for example, surgery has gone from us opening and operating to operating on a scope. Right? We put a camera in and we operate and sometimes we just wonder when we're operating, we'll be talking to each other and we say, do you think gaming makes us better endoscopic surgeons or not? Okay. Because it's hand-eye coordination. But it definitely makes you very antisocial. Lah. Yeah.
It's but you keep like looking
Yeah,
at
you could
it.
just yeah. And that's the same thing with social media and everything, right? How many times have you gone to a restaurant and there'll be six people sitting on a table and every one of them is on a handphone?
Yeah. Okay.
See? Okay. And I always tell my wife when this happens, I said, you think they're talking to each other on the handphone?
Most probably.
Yeah.
Maybe.
Can you
No.
pass me the curry?
But it's still not okay with it, right? Okay. So untuk Encik Shah Rizal Shaharudin, have you ever had a patient come in with an actual serious issue by following an online health myth? Have you heard about your during sepanjang the Subang Jaya Medical Center? Have you ever heard an issue about someone that have an actual serious issue because of following an online health myth itself?
Following online help needs. Okay, I mean, people that come to Subang Medical Center, basically they need some treatment. They have issue for sure, but saying that they are following the health needs, I wouldn't say they're following health needs, but I think like our discussion today, I think I believe the patient is like kind of like searching, googling, just to check what's wrong with him or her, the patient. So to get more info, so they come to the hospital to get treatment when they feel that their body doesn't feel right already, and somehow it kind of like the help needs kind of like agreeing with the situation that the patient have, so they come to the hospital, which is a good move to come to the hospital because for us in international marketing, we receive patient inquiry. Yeah, I believe some of them are using the Google, asking the question, but again, we can't stop them. They will search, they will find info. like I think I'm echoing what Dr. Vicky was saying, that they need to have some knowledge on what they are experiencing. So then only they know. With that also, but by saying that also, I think I believe for marketing is a tools as well, because with that only patient will come to the hospital by when they Google, for example, like international marketing, we receive patient from other countries. So when they go to getting a treatment in their home country, but they already Google, they have knowledge, but the treatment they're getting not as per their expected. So they find a solution, they find a second opinion, where the patient come to Malaysia, come to Subang Jaya Medical Center to get some treatment. So it helps.
It helps.
Yeah.
Okay.
Can I just add a little bit to that? So this myth charita, actually it's always been present, In the old days, people are scared, right? You got something, a bad headache, and the headache's getting worse, or suddenly I can't move my hand slowly, or maybe I'm coughing a lot, and then the phlegm is a lot, or maybe there's a bit of blood I see, takut kan. But you don't want to go and see the doctor. Why? Because you know that this may lead to surgery, it may lead to chemotherapy
Yeah.
and all that. So what do you do? So you, in the old days, you sit in the coffee shop, and then you talk to somebody, and somebody say, "Oh, you go and see that Sinsei, or you go and see that Bomo, or you go and do this." Okay, that
Yeah.
was those days. Today, this have all become on steroids now, because all this is now available in online.
Betul.
So it's not like these myths came up because of online. It's just that social media has boosted the speed at which these myths travel. So till today, we will see patients who come in late because they tried some form of treatment. Okay, it could be traditional treatment, it could be something someone said. When they have a serious problem that actually needs maybe modern medicine, and they have delayed it, and they come, and patients say, "Oh, you go to hospital." My grandmother used to say, when you go to hospital, you go with one problem, you come back with 10 problems, that kind of thing. But today, it's faster lah. It spreads like wildfire.
Yeah, and that's the one time when my kids menghadapi eye infection. Every time my kids woke up to there's a green like infection
Yeah.
something, and I googled it how to cure or something that I can do with it because I need a really fast
Response.
response. So instead I googled it and I checked that there's a myth when you put the mother's breast milk could cure the eyes itself. So I don't. When I read that, I was like, no, okay, I'll see the doctor tomorrow. So because it's not, I don't think it's something that I would do. But what if there's people who follow the myth that it could cure? Because I believe that it's not a right thing to do because it's dirty.
But
Because
people have always done these kind of things. I mean, if I'm not mistaken, I may be wrong, but if I'm not mistaken, years and years ago, they used to put cow dung at the end of the umbilical,
oh
until the child develops sepsis and infection.
oh
Okay? There was some strange belief that says that this works, right? Is it a myth? I don't know, right? But it definitely caused problem. Today we know bacteria,
yes.
it will cause problem, right? And then we also have this, we look at it as myth now, right? But sometimes there's no basis of explanation. For example, I'm sure it's in among the Malays and the Indians and all that, that if someone dies, you're not allowed to go and visit anybody else, or nobody should come to your house and eat from your place. At least in Indians, we have that feeling. Now, that doesn't make any sense, right? Logically, it doesn't make any sense. But think about it. In the old days, they all died from infection. And probably they felt that if you went to the house straight after somebody has died, that bugs are still there, and that's how
Yeah.
it's spreading, right? But if you say you cannot go for the next 30 days, that's a incubation period. Didn't we do that during COVID? Right? So during the incubation period, you're not supposed to go to the house where somebody has died, or you don't go and, eat some. So sometimes there's a science basis behind it, but we just don't know,
Yeah, betul.
right?
True.
So some of these things you need to take with there's some skepticism, but you have to think about it. But breast milk on the eye, I wouldn't do that, lah.
Yeah, I wouldn't. I rather wait for tomorrow.
Yeah, just take to the doctor. Yeah, eyes and all, don't play the fool. Yeah,
And the doctor give the cream to
yeah,
cure, and it works. It actually works.
Yeah.
It's better to see doctors rather
Yeah.
than something like would affect them, especially for eyes. For eyes
yeah.
that they need to use it for their lifetime. Kan? It's better to check to the doctors. Okay.
Yeah.
So, so I think we need coffee for a while. I need coffee. So let's take a break and we'll come back after this.
Health is the greatest gift. Our journey began with one mission: to provide trusted care to those in need. Today, that mission remains at the heart of everything we do. For nearly 4 decades, we have grown with our community, embracing innovation while holding on to the compassion that defines us. Every life touched, every recovery celebrated is a testament to the trust you have placed in us. These stories remind us why we do what we do. As we look forward to the future, our promise is simple: to continue giving gift of health, one patient at a time.
Welcome back to podcast Health Beyond Borders, presented by MHTC, Malaysia Healthcare Travel Council. Okay, so today kita nak proceed with our next question for doctor. As a doctor, how do you handle it when someone truly believe a myth, even if the science says otherwise?
Even if sometimes you want to hit them on the head, you can't do that. So what you do is you have to explain. So very patiently, you have to explain, or you have to draw diagrams. Sometimes you have to make references to, or give them material, yeah, that they can go back and look at, or resources where they can go and see to actually understand what is. But sometimes you just cannot convince them.
Yes.
So then you tell them, okay, you have this problem, and really this needs to be done urgently, or whatever, and tell them, okay, when you're ready, you come back, because you cannot force anybody. You cannot. So and you just hope that they will come before it's really too late.
Yeah. Yeah, sure. Okay, thank you.
Yeah.
Okay, untuk Encik Rizal.
Yep.
What is your hospital embracing innovation, whether in treatment, technology, or patient experience, to stay ahead in the global medical tourism landscape?
Okay, Subang Jaya Medical Center is one of the finalists for flagship medical tourism.
Yes.
This is under MHTC, which is recognized by the Ministry of Health Malaysia. So by being a finalist, we need to be like, meaning to be up in the industry. So taking up your question, talking about innovation and technology, everything, what we have in Subang Jaya Medical Center currently, we have what we call it 1Q system. This is a system we have, for example, in our health screening center. If during last time, for every station, when you're doing a test, you're going to get another number. But with 1Q system, you just have one number that will bring you throughout the entire journey. And actually, you even can scan the number and just monitor from your handphone, your mobile. So meaning if next is your turn, the phone will vibrate. So you need to go to room number 8, for example. So you go. Of course, in the health screening center, there's a monitor, there's a TV to basically check your number. But then the mobile help as well. Also, what we have, because become a medical tourism hospital, we need to support the international patient as well. International patient that admitted in the hospital. Sometimes, for example, we take Indonesian. Okay, Indonesian in a ward at night, feeling hungry, they want some ayam penyet. For example,
Yeah.
doctor, have you tried ayam penyet before? No. Okay,
Now
ayam
I'm
penyet.
hungry. Now I'm hungry.
Okay, after this we take some ayam
Okay.
penyet. Okay, what they have in our ward is we have a QR code where you can order. It's custom, so the order will go straight to our kitchen, and the patient just inform to the kitchen what they want.
Oh, wow.
That what that we have. Another thing maybe I want to highlight also, we have this like a dashboard, a tools where it kind of like collate all the feedback from patient from each station. If long time ago, or even definitely few other hospital are still in a traditional way where you collect manually, but this one sent to the dashboard, meaning from the customer service, what experience, doctor's clinic, we have the QR code where patient can give live feedback. So the live feedback will go to the dashboard, and the dashboard tabulate. So they tabulate something like if you talk about a complaint, so the complaint they will tabulate is like severe complaint and not so severe complaint. So then the team know how to manage the complaint. So of course the severe, you need to go immediately. You need to settle. You need to answer for that complaint immediately. Then we go to the less severe. If last time, you need to manually tabulate, where by the time you manage to see a severe complaint, it's already maybe 1 week. So it's too late. So with this, we kind of like will address the complaint as soon as possible. That's
Wow.
what we have. Of course, uh, I think Dr. Vicky mentioned just now, our neuro surgery, we have the highest technology that we have. Cancer treatment, oncology, that also we have, because we are patient-centered care for the cancer. Uh, Basically meaning it's very hardly we refer patient out. When patient come to Subang Jaya Medical Center, that's a way of treated the patient. Either the machinery, technology, the doctor, all is there. Until up to the end, even palliative care, we have a doctor for palliative care, a good counselor as well, to manage patient and family of the patient, because when come to illness, it's not just the patient that suffer,
Yeah.
but the whole family,
Family,
the whole
betul.
circle. Yeah.
True. True.
Right.
Thank you. And for doctor, let's recap about the technology that Subang Jaya Medical Center has for neurosurgeon treatment.
So, SJMC is actually a very it's an old hospital, right? It's been around for 40 odd, coming to 40 years. So it has everything. It's almost all bases covered. So it's got a very good oncology center that treats all kinds of cancers, chemotherapy, radiotherapy, can give focused radiation for brain tumors, etc. But not just neurosurgery, but also in other areas. It's got an imaging department that has got 3 Tesla MRI scans, 1.5 Teslas. It can do all kinds of imaging, right? For neurosurgery per se, for example, we have got most of the shiny tools we need, right? We can do intraoperative monitoring. When we are doing surgery on the brain, we can monitor the patient. We have got the ability to do operations with patients awake. You saw it in BBC when someone was doing an operation, the patient was playing the violin to test. So we can do things like that. Okay, that can be done. Yeah. But not as glamorous as violin. We just talk to the patient and get the patient to do stuff as the head's being opened. We also have an intraoperative CT scan, a CT scan that can look at the, so as we are operating, and let's say we want to know where we are, what's going on. Have we taken everything out? With the patient's head open or with the spine open, we can do a CT scan, and immediately know whether what we want to do is being achieved. So, for example, if we're putting screws into the spine, we can see if these things have been put in accurately. We've got all kinds of scopes that can be done, not just in neurosurgery. So we do a lot of operations on the brain through the nose, for example, using endoscopes, and we can do complex operations through the nose on the brain. So all these technologies available, but perhaps more than the technology is also the team groups of people who work together. So it's not an individual. It's multi-people. So, for example, if you have heard of a pituitary tumor, this is a tumor that occurs kind of the center of the head. It's from a gland that produces a lot of hormones. So, when you do a complex an operation, the operation itself is not terribly difficult, right? But it's operated by a team of an ENT surgeon and a neurosurgeon for a start. So the ENT surgeon is able to open all the way from the nose right up to the bottom of the skull, and then the neurosurgeon, together with the ENT surgeon, takes out the tumor. But this patient also needs to be monitored by an endocrinologist who has to make sure the hormones and all work fine, an intensivist to make sure that the patient's ICU care is smooth, immediately after surgery, the radiologist to make sure all the necessary imaging, etc., it's done properly. So, and a lab that has got all kinds of facilities that can do all kinds of blood tests and all that. So it is like a team coming and dancing together.
Yeah.
So it's more than an individual. And this is applied to same with vascular neurosurgery. So we are subspecialized. We have a neurosurgeon who does blood vessel problems primarily. And he is supported by interventionalists. These are people who do angiogram to look at blood flow in the brain. They can also block blood vessels. They can open up blood vessels after strokes. He needs an ICU care again, which is supposed to be very good. So it's teamwork, right?
Yeah.
So it's a combination of technology with teams of people able to address the various problems.
And to be honest, after listening and understanding Subang Jaya Medical Center I feel proud. I feel proud because Malaysia has a very good medical center such as Subang Jaya, and having doctor that have been experienced for how many years, doctor?
Oh, do I have to give you the number? I've been
Numbers.
I've been neurosurgery for 25 years.
Oh, okay.
Right,
Wow.
yeah.
Wow. That's to say. Okay. I cannot. Okay, 25 years must be going through a lot of experience, and okay, go see doctor if you have any problem with your brain.
Your
Is it?
brain, yeah.
Yeah, maybe Fika,
Yeah.
if I can just chip in
Add.
a bit, not just about the technology and the team, multidisciplinary team.
Yeah.
When we talk about medical tourism, why Malaysia is the destination,
Yeah.
or I'm here, I will say why Subang Medical Center is a destination.
Yeah.
It's because one of the things we compare us to other country, we are regulated. Our price. I believe maybe in ASEAN, the only country, doctor.
Probably.
Yeah.
Yeah.
So,
Yeah.
yep.
Go on.
Correct. So that's why patients tend to come to Malaysia, Subang Medical Center, because at least they know the range cost of their treatment, rather than they go to other country that the range might be higher. You're talking about 30,000 to 100,000. That's a big range. But in Subang Medical Center, we can give like 30,000 to 45,000. Small range.
They have their
Yeah, we have the shilling cap.
shilling,
Yeah,
yeah.
this is regulated by the Ministry of Health, Malaysia. The like Dr. said, we believe that the only country in ASEAN that at least have that regulation.
Oh wow.
But
That's
but
good.
also I think the healthcare in this country, especially in the bigger hospitals,
Yeah.
is comparable with the first world nation. Right? So the treatment in Malaysia may not differ from what's in UK and the US. Okay, of course, if you look at some of the research and the work, that's a different story. But in terms of technology and the people who can do it, a hospital like Subang is able to do anything that can be done anywhere else in the world, be it Singapore or whatever.
Yeah.
So I think patients also recognize that, and as Rizal has pointed out, that and it's also married with a costing system that potentially is affordable.
Yes.
Yeah.
So, yeah, okay. Thank you. And what's your advice for hospital or clinic trying to build trust in the age of misinformation?
Okay. Talking about misinformation, right?
Yes,
Okay,
misinformation.
misinformation. What hospital can give is, of course, to educate the patient. This is basically to brush off the misinformation. By educate, meaning all hospital staff, meaning with doctors, we every month we have like webinar. We give education. For example, in marketing team, we post a lot of educational flyers, educational posters on certain treatment, certain illness. Uh, yeah, certain even vaccine as well. We do post that, so we try to educate as much as possible. Of course, when come to marketing, it's not bi-monthly, it's weekly. So as much as possible, we educate the patient. Yeah.
Okay. Okay, if your hospital had a Wikipedia page, okay, why you shouldn't Google this? Just come here instead. What would the first line would say?
Okay, Dr. Vicky, maybe I give you chance to answer first, then I can copy a bit your answer for me to
So
answer that.
I think it shouldn't say that. I think it shouldn't say that at all. I think it should say Google this. But
Oh,
if you
okay.
have a doubt, come and see us.
Ah.
Or Google this,
Oh, I like.
but
I like that.
verify it.
Yeah.
Yeah.
Betul.
And we are there for you to verify. Yeah.
Yeah.
Because you cannot stop people from doing things.
Exactly. Because I did the same thing too.
Yeah.
I would always Google it before I come to the doctor. Yeah, I think Google it and verify.
Yeah.
Get verified.
Google and verify. I prefer patients who turn up who know something about what they're having.
Yeah.
It actually makes it easier for me to explain, right? And myth bust as I go along. As opposed to someone who comes in completely blur. And sometimes we do get that, and that's fine. But I rather you have some information. You go with some information, right? And so, because there are, for example, doctors of varying experience, varying philosophy, varying idea, okay? So you will know also how experienced your doctor is, how much work has he done, what are his areas of speciality, right? In the old days, we used to say, oh, a neurosurgeon does all these things. But today, like for example, in neurosurgery in Subang, we are specialized. So other than doing a bit of general work, I do what we call base of skull tumors, taking out tumors at the bottom of the brain, taking out tumors to the nose. That's the kind of work I do. I don't do children because we've got an expert who does children. I don't do blood vessel problems because we got experts in both intervention in Subang as well as a surgeon who can do these kind of operations to restart flow in certain parts of your brain or connect blood vessels up or treat aneurysms. I got surgeons who can do brain tumors, that means tumors inside the brain itself. So we have subspecialized. So it's no more a jack of all trade. So things have improved, right? It's the same like in orthopedics. For dulu orthopedics, everything tulang is orthopedics, right? Everything bone is orthopedics. Today we got joint replacement surgeons. We've got sports medicine surgeons. We have we have
Spine
all
surgeon.
spine surgeon. Well, we got neurosurgery. So got spine too, right? Yeah. So I
Yeah,
have to campaign
right.
for neurosurgery a little bit. Yeah. Okay. So we are subspecialized in such a way, right? So it's no more one person treats everything.
So just now, doctor said about nose with
Yeah. So we operate on the
tumor
brain.
in the.
Yeah. So we operate on the brain through the nose.
Oh,
Yeah. So we work together with an ENT surgeon. So a lot
so
of
I thought it's a nose is a doctor specialized with nose. No.
No, okay. So we got doctors that specialize in nose, and then we got and then they got brain surgeons who specialize in brain. But there's a part of the brain called the skull base, which is at the boundary, right? So we work together with an ENT surgeon, and the ENT surgeon would give me the exposure that I need, and then from below, so you don't see any scars on the top or anything
Yeah.
from below, and then together with the ENT surgeon, we would then remove the tumor from below or some of the other problems from below. We will settle it all to the nose.
Okay, it's getting serious. It's more to like medical podcast right now.
Yeah,
So
yeah,
let's
yeah.
take a break. Let's take a
Okay.
break for a while, and we'll come back after this.
Health is the greatest gift. Our journey began with one mission: to provide trusted care to those in need. Today, that mission remains at the heart of everything we do. For nearly 4 decades, we have grown with our community, embracing innovation while holding on to the compassion that defines us. Every life touched, every recovery celebrated is a testament to the trust you have placed in us. These stories remind us why we do what we do. As we look forward to the future, our promise is simple: to continue giving gift of health, one patient at a time.
Okay, welcome back to Health Beyond Borders, presented by MHTC Malaysia Healthcare Travel Council. So I'm still with my guest today, okay, Dr. and Encik Shah Rizal. Okay, so I want to ask Doctor, some people don't like surgeries. Bukan some, most of the people,
I think all people don't like surgery, except the surgeons.
include me.
Yeah.
Okay, including me, I'm scared because I've watched so many videos on YouTube, how they like blood come in and all. It makes me scared, like really scared. And that's one of the reason why I don't want to become a doctor, because I've seen it's so scary. And where can people actually find credible information about brain health and neurosurgery?
I think there are lots of places you can go for resources. Like if you Google a brain tumor, it'll usually throw up things from the national UK health to certain hospitals in the US and all that. And now even certain Ministry of Health hospitals give you information, or universities give you information. In Subang, we are trying to create some information on some of the brain operations that we are doing. So that's where you can get credible information from the resources, right?
Yeah.
Yeah.
Okay. And for Encik, Mr. Shahrizal,
Yep.
how has Dr. Google changed the way hospitals communicate with potential patients?
Okay, Fika can keep that question for a while. I think I'm just echoing what Doctor was saying just now about operation. Your question is about operation. For marketing, normally we have faced this international patient that basically why they're looking for second opinion,
Yeah.
because I'm sure in their country the solution is operation. So they don't want to have operation. They're looking for second opinion. Here they are in Malaysia, in Subang Jaya Medical Centre, because Subang Jaya Medical Centre and Malaysian medical itself, healthcare itself, operation is the last option. Yeah, doctor, correct?
Actually, I quite disagree with that.
Oh, okay, right.
Yeah, I quite disagree with that, if you don't mind me interrupting.
Okay,
Yeah,
sure.
So people say operations is the last option. Actually, it's not true. Sometimes operation is the only thing that can cure you.
Yeah.
And it's a myth that it's the last option. Sometimes it is the initial option. It is the best option. Of course, everybody wants to avoid an operation if they can avoid it. And that's one of the myths. And then you delay until you go to surgery. So whichever place they're going to, be it Subang or wherever, right? Or whichever doctor is seeing you, he or she should be able to give you the options. So if you come to Subang, for example, and you sign a consent for surgery, one of the questions that the patient is told is, have you explained all the options to the patient? That means if there is a tumor that can potentially be treated by radiation without surgery, I have to mention that. I cannot say, oh, I want to operate. I operate. No. So, and if you cannot give radiation, you have to say why it is not going to work. Okay. Or I have to tell you what are the other possibilities, or after surgery, what else you need to go for. So that's what happens. So it's not the last option. Actually, it's sometimes even the very first option or the only option. Of course, when the patients from, like Rizal has explained, the patients from overseas come and inquire, even local, they want someone to tell you you don't need surgery, right?
Yeah.
That's what they want to hear. But that may not necessarily be the correct answer. So in a big hospital, in most of the big hospitals in Malaysia, and if you're speaking to reputable doctors, they will give you the options, and not just follow. So you must explain, right? Why this method is better than that method.
Yeah.
You must be able to do that. Yeah.
Yeah, I think okay again because you did explain on that. I believe certain treatment you need surgery. That's the
Yeah.
only option. But like what Dr. Vicky was saying, there's always if there's an option, doctor will explain all the option available, then the surgery. Even surgery also have many types of surgery.
Yes. Yes.
So I believe the one that's scared is the kind of surgery that really massive open because now we have that kind of Dr. Vicky already mentioned earlier laparoscopic surgery, endoscopic surgery, robotic surgery. This
Yeah.
is all I can say minimal invasive.
Yeah. So these are the minimally invasive procedures that exist in hospitals. Sometimes this minimally invasive procedure is marketing more than anything else. Sometimes you need a big operation, a real operation, a bigger operation. I won't say a real operation because even a minimally invasive. So when I do an operation through the nose, it looks minimally invasive.
Yeah.
When there's no scar, there's no cuts, no nothing. But inside, it's maximally invasive
Oh.
because what I'm taking out is in a very complicated part of the brain where there may
Yes.
be nerves, there may be blood vessels, and we may have to dissect these tumors away from there.
Yeah.
But the patient wakes up and the patient looks at the mirror and says, I don't look like I've had surgery. But actually, you have had a massive operation inside the head. Right? There's some operations that I do in base of skull. There we have an incision behind the back of your ear. Right? And once the hair grows, right, you don't even know that they have had surgery. Right? But inside is massively invasive because we are taking the tumor away from important nerves, the spine, the brain stem, pangkal otak. Yeah. So all this is actually maximally invasive. When they do laparoscopic surgery, all you see is like 4 or 3 holes in the stomach. But once they are inside, they are dissecting, they are taking things apart and putting things back together. So, but to be able to do all that, you need expertise, you need machines, you need support. Yeah.
Yeah. And talking about surgeries, actually, even sometimes people, even those who are desperately need the surgery, such as a mother that need to give birth, using a scissor, refuse to do that. Means they are afraid to do the surgeries. That's the kind of,
Yeah.
that's a level of,
So that's a myth. Yeah.
yes, that's a bit.
Yeah, that's a myth,
Yeah,
right?
that's a myth.
And if you need to have it done, it needs to be
It
done.
needs to be
Yeah.
done. Yeah.
Yeah. It's just sometimes the doctors don't spend enough time explaining it,
Yeah, betul.
right? Sometimes we in our busy day will may brush aside certain questions. You see, for me, it's like a very basic question. Why are you asking me this question, right? But for you as a patient, that's a very important question.
Yeah.
Yeah, it's very important question. Like patients will ask me, "Are you going to shave my hair?" And then I have to explain to them that's the most expensive hair shave you're going to get for the whole life. Okay, but we'll have to explain that to them. Okay, 20 years ago when we did neurosurgery, when I was no, not 20 years ago, 30 years ago when I was training in neurosurgery, patients were happy if they come out alive or they don't have major deficit. Today, my patients will ask me, I got a dent at the side of my head here, okay, and that's bothering me. But you don't realize that inside a whole load of things have been done, and you are well enough and you're good enough that you are asking me about the dent on the side of your head, which for me is a good question, lah. That means we did okay, we did well, right? But patient expectation is changing, right? And people like you watch YouTube of surgery. I don't understand why people watch YouTube of surgery. I cannot understand that. But it is what it is. we all look for different things for entertainment, I suppose.
Yeah. Okay. And when patients are choosing a hospital from another country, Encik Shahrizal, how important is a hospital's online presence?
Okay. How much? I mean, when you talk about the traditional way, word of mouth is the best marketing tools.
Yeah.
That's the best. But in nowadays, this era, online is very much important because you're talking about international patient in other country. Uh, they need to know your hospital. They need to know what kind of promotion that you have, if you have. They need to know your profile of your doctors. So with online, and like I mentioned earlier, that we always post educational materials, poster in our website, in our social media. So this is where the international patient uh, uh, caught the info before they decide to make an appointment with the hospital. So very much online is very important tools nowadays.
Very helpful.
Yeah,
Yeah.
very helpful.
And what are some things international patients think they know from Google or social media, but are often surprised to learn differently once they arrive?
Okay, this is I'm not sure in the earlier part we mentioned we already 40 years. I believe Dr. Vicky did mention we're already 40 years old. Since we one of the established and earliest hospital, so most of the patient when they hear that they thought our hospital is kind of like 40 years old. That's it, nothing much. How much we look as an established old hospital from the outside, from the facade. But once you go into the hospital, you can find Subang Medical Center have very fully equipped machineries for all kind of treatment that we have. All the latest technology, name it, for the cancer, neurosurgery, for cardio, we have that in place.
Okay. And how can hospitals or marketer staff work better together to fight online health myth?
Okay. Again, I believe I'm repeating this again. This is all about education.
Yeah.
Yeah, I think when you talk about the nurses, the hospital clinics, you need to have basically. If you, I think if you go to any hospital, they have all this poster.
Yep.
This is where the education start. I mean, if you are in the hospital, but in the online era nowadays, it start from online.
Yes.
You
Yes.
post, and with doctors, with webinar, all these things, we educate as much as possible. But again, we cannot stop patient Google for info. I think that the question that I held just now, you forgot to ask me again. How is Google
Yeah.
affecting the hospital?
Yep.
Yeah, we cannot stop. Let them Google. Like earlier part when Dr. Vicky mentioned that patient need to have some knowledge.
Yes.
Then actually that's good to make the doctors uh, on top of their game. They knows what to expect. So patient will have that satisfaction when they see the doctor. They will ask a lot of question. So when they go back, they satisfied. What they know might be correct. Doctor agree with it or not right at all. Doctor will say not like that. It should be like this. So they know somebody that already a doctor himself explain to the patient what you got from Google. Is it again for international patient? Normally they ask an inquiry. We always get a full medical report. That's very important because we don't want them just send us a Google question, you know,
Yeah.
medical report. Send then with the medical report, we will send to our doctors to evaluate for further treatment, plan of treatment. Yeah.
And if I might add, actually it's like a funnel, okay, a chorong, right?
Yeah.
So I have a problem. The first thing I do is I Google AI or whatever, okay, and I get my basic information. The next step will be I will look at who can possibly treat this, whether in my own country or abroad or whatever. Okay, so for this, I think the hospital needs its presence, right? So when you Google, Google knows where to search, what information. AI also is important, so it knows whose name to pull up, what to come up. Okay, then like Subang has also the ability where we can do Zoom meeting with people overseas. Okay, so they don't have to come straight away because it's expensive.
Yeah.
So they can arrange for appointments with me, for example, anyone, where we can do a Zoom conversation and we can have a conversation with you and look at your results, blah blah blah. Of course, it's not the same as touching, feeling, examining
Yeah.
the patient. You don't get all that, but it's already like getting better and better, right? Then the funnel moves down, right? Then the patient comes for treatment. When the patient comes for treatment, then the patient is then exposed to the hospital itself and the staff and the facilities, and then they go through their experience. Now this then feeds back up back into that original AI Google punya information database, right?
Yeah.
Then other social media will come in, or patient will put up in their TikTok lah, Instagram lah, whatever lah, okay? That, oh, I went and saw this hospital, I went and saw that person, oh, he was very good. So it's a cycle lah. So in today's world, we cannot escape that cycle. This cycle existed 50 years ago, but the cycle was slow. Today, the cycle is on steroids,
Yeah.
right? Sometimes when something goes wrong, rightly or wrongly, people are going to put it on Instagram lah, this lah, I went for this and the food had a cockroach. There's so many other things there, right? Okay. And the hospital has to fight and counter these problems and these issues and all that, right? And that, as Rizal has rightly pointed out, it's all education.
Yeah.
Yeah. So you cannot run away from Google. You cannot run away from AI. You cannot say you cannot look at it. You must ask it. No. Every one of the component is actually very important. Some parts of the component are becoming more important. AI is going to replace, ChatGPT is probably going to replace Google as your go-to to ask any questions,
Yeah, true.
right? And one must know what's the difference between a doctor and the information from an AI. And doctors must know how they're going to compete with AI and how to stay abreast with what they're doing. And overall, I think it'll just improve health delivery.
Yep. Okay. And since I have an opportunity to ask doctors face to face, okay, let's get back to my question on ChatGPT. Last night it's 2 a.m. and I was wondering why is my right head feel headache at my right instead of
The whole head.
the whole head.
Oh, it's like now consultation ni, podcast.
Ini macam consultation ni.
It's a free consultation, so
Okay,
I'm
free
gonna
consultation,
ask.
yeah. 90% of headaches don't mean anything.
Oh.
Okay, your headache is probably because you knew that you're going to interview some people tomorrow, not in medical side, so the stress and the tension probably gave you a headache, right?
Yeah.
Unilateral headache for one night means nothing actually. And I also can't tell you what the cause is. Okay, it's probably stress, tension, whatever,
stress.
right? Now, if the headache then starts to persist for a few days or seems to get worse or you start to vomit and all that, okay, then you better start worrying about it, right? Majority of us have a little bit of headache.
Yeah.
At point in time, I've just been told my car window is down somewhere, so I got a headache. So, but it's not important, right? And that's the dangerous, and that's exactly the dangerous part of the headache, because you put headache into ChatGPT or Google, it'll tell you got brain tumor, you got brain hemorrhage. So that's the dangerous part,
Yes.
right? And then you get into a panic,
Yes.
right?
True.
Yeah. But then if you ask the correct context, the next question in your AI should be, how frequently is a headache related to a brain tumor? And say less than 10%. Okay. What are the other features of a headache from a brain hemorrhage? I'll tell you, you must be unconscious, you must be vomiting, you have got to have weakness on one side. The headache is so severe, then you know I have not. But people only ask that first question, I got brain cancer.
Yeah.
And
That's why it's very important to seek for help.
Yeah.
See doctor to get the
yeah.
verify your
Yeah.
your
If you are really
symptoms.
worried about it after your second
Yes.
and third question,
Yeah.
then it's time to get some real help.
Yeah. True. Okay.
Not ask the influencer in TikTok.
Yeah, because we can see that so many health influencer,
Okay.
sharing about health issue and trying to confidently, menyatakan the
Their solution.
their solution. That is scary.
Yeah.
It's actually scary. Okay, after all that, why SJMC?
Okay, why SJMC?
Why Subang Jaya Medical Center?
Why Subang Jaya Medical Center?
Yeah.
Okay, first of all, the big point here, we are one of the established private hospital in Malaysia. We are already 40 years old this year in August. We also been appointed by MHTC as the flagship medical tourism hospital. We have specialty and subspecialty in our hospital a lot, and we are kind of the hospital, Subang Jaya Medical Center, that really focus on result and accreditation.
Betul. True.
Okay, if you compare, I mean, if a hospital, I mean, no, let me rephrase that. If a patient want to look for a hospital, they will ask, what is your center of excellence? What is your strength of the hospital? I believe all hospital will say cardiology, oncology, these two. But with SJMC, I can say we are strong in cardiology, we are strong in oncology because we are being accredited as Center of Excellence by ACHS, is a Australian accreditation body that already came to the hospital, do their audit. So we have the certification. So it's something like similar. If you want to go to a restaurant, since we're talking about ayam penyet just now, restaurant ayam penyet A and restaurant ayam penyet B.
Yeah.
Ayam penyet A is just a normal ayam penyet, but ayam penyet B have a certification saying they are the best 2024. You think which one will you choose?
Cleanliness A, halal
Correct.
certificate,
Yes.
certificate doctors.
Yeah.
Yeah.
I don't want to talk about awards because
Yeah.
we have a lot of awards.
Yes.
Other hospitals also have a lot of awards, but I'm talking about accreditation, a certification. That's not many hospital have. That SDMC have a lot of this certification. We even strong. We have certification in pediatric as well. Because I have a partners in Indonesia that kind of like refer patient to the hospital. She mentioned to me, Rizal, if I have a pediatric cases, you are the first hospital that I look for. Because when come to pediatric, we have a lot.
Yeah.
You name it. Neuro, we have for pediatric.
Yeah.
It's under Dr. Vicky team. We have for gastro, we have bone, we have
Yes.
gastro, we have dermatologist, we have
Cancers.
cancer, we have a lot for pediatric. That's
So-
why we've been certified.
So Subang Jaya Medical Center that apa? Ada yang tak ada. Tak ada langsung yang tak ada. I mean,
We are multidisciplinary
have any-
hospital.
Yeah.
Basically, we have treatment A to Z. Except I have to mention we don't have IVF.
oh, okay.
But for doctors that kind of like for pre checkup IVF, we have that. But the
Oh.
treatment of IVF, we don't have that.
Because the IVF have their own hospital for IVF specialists for IVF, is it?
Yeah, normally they have their own
Normally they
clinics,
have-
correct.
True.
We don't have that in the hospital.
Yeah,
But
true.
beside that, we have in SJMC.
So basically, SJMC has everything you need.
Right. Yeah.
Okay, thank you so much.
Okay, thank
That's why you guys have to choose Subang Jaya Medical Center. So thank you, doctor. Thank you, Encik Shahrizal.
Thank you.
Okay, and that's a wrap on Today Myth. Okay, and busting session. So that's a wrap for today. Dr. Vickneswaran. Okay, and Encik Shah Rizal. Thank you so much for being here. We're truly honored to have you with us today. And thank you for sharing your time, expertise, and valuable insights. Thank you so much. It's been a privilege to learn from you too. Okay, thank you so much. And if you learned something new today or had a myth completely shattered, share this episode with a friend, your mom, or that one cousin who swears by garlic for everything. Okay?
Garlic is good for you.
Garlic is good, yes. I eat garlic. Every time I cook nasi, doctor, I would put garlic.
I put garlic for everything I cook.
Yeah,
Okay.
that's good. Garlic is good. So it's not a myth. It's not a myth.
Who knows?
It's me.
Okay, and don't forget to follow us on Instagram, on YouTube. Don't forget to subscribe our YouTube channel. So thank you, everyone. If you get a health myth you want us to investigate next, drop your comment down below. Okay, thank you, everyone. Bye. Thank you, doctor.
Thank you.
Okay,
Thank you.